getting up from a chair feels a little slower now, or climbing stairs leaves your legs more tired than it used to, I want you to stay with me, because what happens to your muscles after 60 is one of the biggest changes in the aging body, and most people do not notice it until it starts changing daily life. It does not always begin with a dramatic fall or a sudden loss of strength. More often, it begins quietly. A slower walk to the mailbox. A hand on the counter for balance. A harder time carrying groceries. A pause before stepping into the tub. And here is the part that matters most. These small changes are not just about getting older. They are often signs that your muscles are asking for help. Many people think muscle loss after 60 is only about looking thinner in the arms or legs. But that is not the real story. Your muscles do much more than help you lift things. They help you stand up, stay steady, protect your joints, support your bones, control blood sugar, and keep you moving with confidence. When muscles get weaker, everything can feel harder. You may feel less safe on stairs. You may get tired faster when walking. You may stop doing little things you used to do without thinking. And that is how independence can slowly start to shrink. Here is what many people miss. The first signs of muscle weakness after 60 often do not feel like muscle problems at all. They can feel like low energy, poor balance, slower movement, shaky legs, sore hips, or a fear of falling that you cannot quite explain. So today, I want to walk you through what really happens to your muscles after 60, the warning signs people ignore, the common mistakes that make it worse, and the simple habits that can help you stay stronger for longer. And before we go deeper, I would love to hear from you. Tell me your age in the comments, or tell me the first small change you noticed in your strength, maybe climbing stairs, opening jars, getting off the couch, or walking longer distances. And if you want more calm, simple, trustworthy health guidance for aging well, subscribe and stay with me, because later in this video I'm going to share one of the most overlooked daily habits that quietly speeds up muscle loss after 60, and most people never connect it to their legs, balance, or energy. Let's make this simple. After around age 30, muscle strength slowly begins to decline, and that loss tends to speed up later in life. After 60, many people begin to notice it more clearly. Doctors sometimes use the word sarcopenia. That is just a medical word for age-related muscle loss. But the change is not only about losing muscle size. It is also about losing muscle quality, muscle power, and the speed your muscles can respond when you need them most. That last part is so important. You do not just need muscles that exist. You need muscles that react. You need them to catch you if you trip. You need them to push you up from the toilet, steady you when you turn too fast, and help you step over a curb without feeling unsure. This is why some people say, "I don't think I look weaker, but I don't feel as steady." That can be real. Muscle power can fade before the change is obvious in the mirror. Now, why does this happen? Part of it is natural aging. As the years go by, the body becomes less efficient at building and keeping muscle. Muscles also may not respond to food and exercise as strongly as they once did. In plain language, your body needs a clearer signal to stay strong. That signal usually comes from regular movement, strength work, enough protein, and proper recovery. Without that signal, the body starts trimming away what it thinks it no longer needs. And then life adds to the problem. A bad cold. A hospital stay. A painful knee. Grief. Poor sleep. A season of sitting more. A fear of falling. A few months of doing less can take more from the muscles than many people realize. This is one reason muscle loss after 60 can seem sudden. It often is not sudden. It is just easier to notice after one extra push tipped the balance. Think about an older adult who used to take walks every day. Then winter comes, The weather gets cold. One hip starts aching. Sleep gets worse. Meals get smaller. A few weeks pass. Then a few months. When spring comes, that same walk feels much harder. It can feel shocking. But it did not happen in one day. The muscles were slowly getting less work, less fuel, and less support. So what are the warning signs? The most common ones are subtle. Getting out of a chair without using your hands becomes harder. Carrying laundry feels like a chore. You avoid stairs when you can. You walk slower. You feel less steady when turning around. You hold onto furniture more often. You feel tired after errands that used to feel easy. You stop kneeling in the garden because getting back up is too hard. You notice your legs feel weak after sitting for a while. You may even feel more achy, not because the muscles are working harder, but because weaker muscles make joints do more of the job. Here's the part many people miss. One of the earliest signs of muscle decline after 60 is not pain. It is hesitation. That tiny pause before standing. That second thought before stepping down. That hand reaching for support without fully realizing it. When confidence drops, movement often drops too. And when movement drops, muscles weaken even more. That cycle can sneak up on anyone. Now let's talk about common mistakes. The first mistake is thinking that walking alone is enough. Walking is wonderful. It helps the heart, the lungs, circulation, mood, and overall health. Please keep walking if it is safe for you. But walking alone may not fully protect muscle strength after 60. Your muscles need challenge. They need some resistance. That can mean gentle strength training with a band, light hand weights, standing up from a chair more than once in a row, wall push-ups, step-ups, or simple leg exercises guided by a physical therapist or trainer who understands older adults. You do not have to become a bodybuilder. You just need to remind your muscles that they are still needed. The second mistake is eating too little protein. This is more common than people think. Many older adults do not eat enough at breakfast or lunch. Coffee and toast. A bowl of soup. A few crackers. That may be easy, but it may not give your muscles enough building material. Muscles need regular support through the day. Eggs, yogurt, cottage cheese, beans, lentils, fish, chicken, milk, tofu, or other protein-rich foods can help. If you have kidney disease, liver disease, or other medical conditions, this is a good place to talk with your doctor or a dietitian before making big changes, because your needs may be different. The third mistake is sitting for too long without breaks. Long sitting is a quiet thief of strength. When muscles are not used, the body begins to let them go. That is one reason even short movement breaks matter. Standing up every hour. Walking through the house. Doing a few sit-to-stands from a chair. Marching in place during a TV break. These tiny signals tell the body, keep this muscle. I still use it. The fourth mistake is ignoring sleep. Poor sleep and muscle weakness are closely connected in real life. When you sleep badly, you are more tired the next day. You move less. You may skip meals or choose foods that do not help much. Your body also recovers less well from activity. So if you have been feeling weaker and more tired, and your sleep has been poor, that is not something to brush aside. Sleep is part of muscle health too. And here is the overlooked daily habit I promised you. Many people do not realize how much poor appetite speeds up muscle loss after 60. If you are skipping meals, eating very little because food does not taste the same, or feeling too tired to cook, your muscles may be paying the price. This is especially common after illness, after the loss of a spouse, during depression, or when many medications affect appetite or digestion. Sometimes the issue is not laziness or aging. Sometimes it is that the body is simply not getting enough fuel to hold on to strength. That brings me to medications. Some medicines can make people feel dizzy, sleepy, weak, less hungry, or less steady. That does not mean the medicine is wrong, and I am never telling you to stop a prescription on your own. But if you have noticed new weakness, more falls, more confusion, poor appetite, or a sudden drop in energy, it is wise to ask your doctor or pharmacist for a medication review. A simple question like, could any of my medicines be affecting my strength, balance, or appetite, can open a very helpful conversation. Now, what can you do to support your muscles after 60 in a safe, realistic way? First, pay attention to daily movements that tell the truth. Not your best day. Your normal day. How easy is it to rise from a chair without pushing off with your hands? How steady do you feel getting dressed while standing? Can you climb one flight of stairs without feeling like your legs are giving up? Can you carry groceries from the car without stopping? These ordinary moments reveal more than many people realize. Second, add some form of strength work 2 or more times a week if your healthcare professional says it is safe. Start where you are, not where you think you should be. If all you can do right now is 5 careful sit-to-stands from a sturdy chair, that is a beginning. If your raises while holding the kitchen counter feel challenging, that still counts. If using a resistance band for your arms feels light, good. Light can become stronger over time. The goal is not perfect exercise. The goal is steady practice. Third, do not forget balance. Balance is not separate from muscle. They work together. Stronger legs help balance. Better balance helps you move more. Gentle balance practice may include standing with feet closer together while holding a counter, walking heel to toe with support nearby, or doing exercises from a physical therapist. If you have fallen before, if you feel dizzy, or if you are afraid of falling, please bring that up with your doctor. A good fall prevention plan can make a huge difference. Fourth, eat in a way that supports strength. Try not to let the whole day pass with very little protein. Think in simple ways. An egg in the morning. Yogurt in the afternoon. Beans with dinner. A small protein snack if your meals are light. If chewing is hard, look for softer options. If cooking is tiring, keep easy foods around. If you live alone, ask for help setting up simple meals. There is no shame in making food easier. Easy is better than skipped. Fifth, protect recovery. Drink enough fluids unless your doctor has told you to limit them. Dehydration can make you weak, dizzy, and confused. Give yourself enough sleep. If pain is limiting movement, ask for help instead of just doing less and less. Sometimes a physical therapist, better shoes, a cane fitted correctly, or treatment for arthritis can help you move enough to keep the muscles engaged. Now I want to talk about something emotional, because this matters too. Losing strength can feel scary. It can make people feel older overnight. It can make them feel embarrassed, frustrated, or dependent. If that is you, please hear me. You are not failing. Your body is changing, and it needs support, not shame. Many people regain confidence when they begin with very small steps. Not because everything gets fixed in a week, but because they feel control returning. That sense of control is powerful. Sometimes the biggest win is not dramatic. It is getting out of bed more easily. It is standing to cook without leaning so much. It is feeling steadier in the shower. It is walking through the grocery store without looking for the nearest place to sit. These are not small things. These are quality of life. These are the moments that protect independence. There is also a serious side to this. Weak muscles after 60 can raise the risk of falls, frailty, and loss of mobility. That is why early attention matters. If your weakness is getting worse, if you are losing weight without trying, if you have repeated falls, trouble swallowing, severe fatigue, or big changes in walking, please talk with a healthcare professional. And if weakness is sudden, especially on one side, or comes with chest pain, trouble breathing, fainting, severe swelling, or sudden confusion, get medical help right away. Those are not signs to watch and wait on. But here is the hopeful truth. Muscles can respond at older ages. Maybe not the same way they did at 25, but they can respond. Older adults can build strength. They can improve balance. They can walk better. They can feel more stable and more confident. Progress may be slower than people want, but slow progress is still progress. And often, the body responds better than people expect once it gets the right signal. So if you remember one thing from today, let it be this. Do not judge your muscle health by how your arms or legs look. Judge it by how you live. How you stand, walk, carry, turn, step up, and recover after effort. That is where the real story shows up. If those things feel harder than they used to, do not panic, but do not ignore it either. Notice it. Act early. Ask questions. Strengthen what you can. Feed your body well. And keep moving in the safest way your body allows. You do not need a perfect body to age well. You need a supported body. A body that is used. A body that is nourished. A body that is given a reason to stay strong. And if you start with one simple step today, make it this. Stand up a few extra times, take a short walk, and pay attention to how your body feels when you move from sitting to standing. Those transitions tell you more than almost anything else. If this message helped you, please share it with someone you love who may be feeling weaker but does not know why. And tell me in the comments what daily movement feels hardest right now. Getting out of a chair, climbing stairs, carrying groceries, walking farther, or feeling steady on your feet. I read those comments, and they helped me create the next video with you in mind.